This is Nursing Australia, proudly brought to you by APNA, the Australian Primary Healthcare Nurses Association.
Hello and welcome to Nursing Australia. I'm Suzanne Blackeby. As nurses, ongoing professional development and collecting those CPD points are never far from our minds. We want to be on top of our game. This episode is for any nurse that upskills or those listeners out there who are simply interested in vaccines, wounds and establishing nurse-led clinics. There are opportunities for education to improve your scope. We revisit some familiar ground and have some tips to keep up that lifelong learning. So to kick things off, inside this latest instalment of the podcast, let's get educated as we chat influenza vaccination.
Despite these low rates of influenza that we saw in 2020, the population is still at risk, particularly now the country has almost completely opened up.
Then discover some free online wound care learning opportunities.
Chronic wounds affect nearly 500,000 Australians at any one point in time, and people who are older or have a chronic disease are at much more risk as well.
And finally, we explore nurse-led clinics.
In the primary care setting, the nurse clinic models support a coordinated approach to care delivery with nurses at the forefront of that coordination.
And if you are listening on Apple or Google Podcasts, please don't forget to tap the subscribe button. And on Spotify, click follow. But first, let's hear the latest in healthcare news.
Mandatory vaccines for residential aged care workers. The Commonwealth revises its national vaccine allocations as COVID reignites. A blood test to diagnose Alzheimer's, and a superhero delivers vital equipment to a regional clinic. This is Nursing Australia News. Hello, I'm Casey Mannix. Following two previous attempts, the National Cabinet has finally agreed to mandate COVID vaccination for residential aged care workers. By mid-September, at least one dose of a vaccine must be administered to all members of the workforce. This mandate comes following alarming self-reported figures from aged care providers, which revealed only 1/3 of the workforce are currently vaccinated.
We have agreed to mandate vaccination to have at least one dose by mid-September 2021 of all residential aged care workforce against COVID-19 as a condition of working in a residential aged care facility.
As the uptake of the AZ jab continues to wane, the Commonwealth Government have released a renewed rollout plan. Dubbed the COVID Vaccination Allocations Horizons, the strategy promises to vaccinate Australia by the end of the year. AstraZeneca will be phased out in favour of Pfizer and Moderna. It is unclear whether Novavax will be included as part of this vaccine cohort. To date, diagnosing a patient with Alzheimer's disease relies on clinical assessments, brain imaging, and at times lumbar punctures to achieve a definitive diagnosis. However, an international research team from London and Hong Kong have developed a far less invasive blood test. The researchers devised a panel which detects biomarkers of Alzheimer's, which they purport as being 96% accurate. The system can also differentiate among the early, intermediate and late stages of the disease. Chris Hemsworth has lived up to his on-screen superhero persona after helping to donate thousands of dollars worth of much-needed equipment to a regional not-for-profit clinic. Armagin Aboriginal Health Service in Armidale, New South Wales received the donations after the National Geographic Channel wrapped filming of an upcoming doco about the human brain, which Hemsworth is hosting.
The last 18 months has seen COVID stifle the conversation and awareness of other communicable diseases. Therefore, it may not surprise some of us to learn that influenza vaccination rates in Australia have waned recently. Is this COVID-driven complacency? Or perhaps the decreased community mobility explains the lull? Year to date, we are some 1.5 million flu jabs behind last year. So, it is vital that we continue to fly the health promotion flag for influenza vaccination. In addition, this year, the Australian Immunisation Handbook has heralded an exciting newcomer to the vaccine influenza market, a cell-based vaccine, which has only been recently approved for use in Australia. I caught up with two of our resident nurses here at APNA, RN and RN Immuniser Joe Millard, and RN Matt St Ledger.
Matt, can you give us a little bit of an overview
of where we are with influenza prevention in Australia? I understand that the numbers have been quite different this year to last year, both in infection and immunisation rates.
Sure, there was certainly a lull in numbers in the last year, probably secondary to COVID isolation. So we know that in 2019, there was over 300,000 lab confirmed notifications of influenza for that calendar year. But then in 2020, there was that dropped significantly to just sitting on 21,000 lab confirmed cases. And so perhaps this data, what one could speculate, does not accurately reflect influenza activity in our community. And interestingly, immunisation expert Professor Robert Boyce said that despite these low rates of influenza that we saw in 2020, that the population is still at risk, particularly now the country has almost completely opened up with a few intermittent exceptions. And I mean, he said recently, if we let our guard down, flu can come back with a vengeance. And further, this year has an added risk as people may feel falsely that the COVID-19 vaccines that are currently rolling out will protect them against the flu, but frankly, it won't. And we know now, in terms of a current picture as of today, we're sitting on just over 7 million flu vaccines have been administered this season. And this compares to same time last year, figures around the 8.6 million. So around 1.5 million flu vaccines short comparatively to this time last year. And in terms of what we see in influenza, clinically speaking, I mean, most nurses would be aware of the serious secondary complications, including respiratory illnesses, most commonly croup, pneumonia, other respiratory diseases and processes, and also cardiovascular compromise is still right up there on the list. And most commonly, we're seeing secondary bacterial pneumonia in those who generally have some sort of underlying comorbidities that'll make them more vulnerable to influenza. And these people are at high risk during epidemics, influenza epidemics particularly, and may die of pneumonia or cardiac decompensation. And an interesting fact is that we know that secondary infections due to influenza A strains are more likely to lead to severe morbidity and increased mortality comparatively to influenza V or the seasonal influenza A H1N1 strains.
So, Jo, when nurses are recommending influenza vaccines to their patients and families, who should they be recommending flu vaccine to?
So some of the people that we should be considering are people in groups that are more at risk of complications from influenza and that are eligible for annual influenza vaccine free under the National Immunisation Program. And these people include Aboriginal and Torres Strait Islander people aged 6 months and over, children aged 6 months to under 5 years, people aged 6 months or over who have a medical condition that means they have high risk of getting serious disease, pregnant women at any stage of pregnancy, people aged 65 or over. So those of us not meeting the criteria for free vaccines through the NIP can purchase the vaccine from any immunisation provider such as your usual GP practice, local council and pharmacy. For those in the pharmacy area, it's for age 10 years and over. And remember that 2 doses, a minimum of 4 weeks apart, need to be given to children less than 9 years of age in the first year of receiving influenza vaccine. And only one single dose is recommended in subsequent years.
Now, the influenza update for the 2021 season has been done in conjunction with authorities and the Australian Immunisation Handbook. So there's been a significant change this year to the flu section of the handbook, and that's the introduction of a new vaccine, Flucivax Quad. Matt, can you tell us a little bit about this new vaccine that's come to market?
Yeah, so this is the first approved cell-based vaccine in Australia, and until now, all influenza vaccines supplied in Australia were made by the traditional method, which is viruses grown in fertilised hens' eggs. But Flucivax Quad is made from viruses which are grown in advanced mammalian cell culture lines. So we now know that Flucivax Quad is recommended for all people above the age of 9 years. Unfortunately, it's not funded under the National Immunisation Program, so there is a small out-of-pocket fee. But I guess reasons why someone might consider Flucivax as an alternative flu vax would be that some observational studies recently have shown that these cell-based vaccines can be actually more effective in preventing influenza and influenza-like symptoms. While the existing guidelines we have do support the use of traditional vaccines, as you know, with people who have egg allergies, I guess Flucivax offers immunisers an additional alternative which they could provide to those that have some hesitancy. I guess if they have allergies, some additional reassurance.
So where are we now with COVID vaccine and flu vaccine administration? There's been some differing information over time and the advice has changed a little bit recently. What should we be doing now as far as giving those vaccines? How far apart? Can we give them together? What's the story?
We're learning as we go, Suzanne, so things do change. The Australian Technical Advisory Group on Immunisation, ATAGI, has advised vaccination providers about the timing of administering influenza vaccines and COVID-19 vaccines. And they advise that there's no safety or immunogenicity data on co-administration of influenza vaccine and any COVID-19 vaccines. The preferred minimum interval between the influenza vaccine and dose of COVID-19 vaccine is 7 days, and that was a longer period of time a little while ago. So please keep checking for updated information. So a shorter interval, including co-administration, is acceptable in some settings and some instances. So some of those are increased risk of COVID-19 for the person that is in front of you, or another vaccine preventable disease, such as there's a COVID-19 outbreak, influenza outbreak, or there's a patient has a tetanus-prone wound. Logistical issues, so that could be difficulty scheduling visits to maintain the 7-day interval. So that could be someone travelling or some other situation. Influenza vaccine can be given before or after any dose of a COVID-19 vaccine with a minimum interval of 7 days. And an influenza vaccine can be given in between the 2 doses of COVID-19 vaccine as long as there is a 7-day interval between the differing vaccines. So when scheduling influenza and COVID vaccines, healthcare providers need to prioritise COVID-19 vaccines for patients who are eligible to receive the vaccine now and then schedule the influenza vaccine. And we've seen just recently discussion around that in the aged care setting. So just remember, COVID-19 vaccine is the priority, and then schedule in the influenza vaccine around the COVID-19 vaccine for the eligible groups.
So essentially with COVID vaccines and the flu vaccines, there have been some changes around timeframes. At the moment, 7 days is preferable, but there are certainly special considerations to be given for high-risk patients and high-risk situations where that can be altered. So that's where nurses are great at critical thinking and sorting through that. And, there's always other resources nurses can turn to get more advice. For the latest vaccine updates, you can visit the Commonwealth Health Department's website at health.gov.au. And there's also the official Australian Immunisation Handbook app available to download free from your app store. The links are in the show notes.
45% of nurses reported feeling regularly or sometimes isolated, alone or lacking support from other nurses in our 2019 workforce survey. So we've been cooking up your newest member benefit, the APNA online community. A space for members to seek support, advance their knowledge and share their own knowledge. The online community is not only a forum, but also a member directory, a news hub, an events calendar, and a video library all in one spot. Head to www.apna.asn.au to log in and start using your new member benefit today. If you're a nurse working in primary healthcare, you'll know that every day is different. And sometimes things can happen that are out of your control. APNA's professional indemnity insurance covers you for everything within your scope of practice except for delivering babies. Will satisfy your APRA registration requirements and covers you for administering the COVID vaccine. We've negotiated a deal with Insurance House so our members can get cost-effective professional indemnity insurance for a small price of only $130 per annum. Head to apna.asn.au/insurance and have peace of mind that you're comprehensively protected so you can focus on being the best nurse you can be. I mean, even Tom Cruise wouldn't risk the business of not having adequate insurance coverage.
So wound care, wound management, All things wound related are really trending topics for us nurses. Nurses love wound management. I love it myself. I'm really excited about the upcoming 2021 APNA Conference Roadshow, and also really excited to deliver some free education to our members and any registered healthcare professionals out there that do listen to the Nursing Australia podcast. And I caught up recently with a senior clinical specialist from Smith & Nephew who talked about their involvement with the Roadshow, some wound workshops that we'll have running at our conference, and also the online speed learning modules that you can register and do as a healthcare professional to get up to speed with the latest in wound care management. Ruth, can you tell us about Smith & Nephew's involvement in the 2021 APNA Conference Roadshow?
Yes, sure. We're really excited to be able to support APNA in this roadshow event, and we're really looking forward to being involved. Obviously, from our perspective, from a wound care company, we're obviously very passionate about wound care, and chronic wounds affect nearly 500,000 Australians at any one point in time. And people who are older or have a chronic disease are at much more risk as well. And that the cost of the healthcare system is estimated to be like $3 billion a year. So we know that the impact of wounds can be enormous. It's an enormous burden to the individual as well as our healthcare resources. And primary care is often the first port of call for patients suffering with wounds. So we're really looking forward to support this roadshow to raise awareness of wounds and the latest evidence-based care. At Smith & Nephew, we strive to help healthcare professionals to get closer to zero the human and economic cost of wounds by supporting with education, with resources and innovative product solutions. And so it's a real privilege for us to be able to support APNA and nurses working in the primary care setting who are looking after patients every day with wounds. So yeah, we're really excited to be involved.
So what can nurses expect from the wound workshops?
Obviously, we're going to hopefully bring a bit of theory, but part of it as well is going to have some practical interactive workshops. So hopefully some case scenarios, some product information, application demos, tips and tricks. And also, we'll provide an opportunity to ask us questions and have some discussions with us and hopefully with your colleagues as well. And so we're keen to provide practical tools that can help in everyday clinical practice and help point you to further resources to help support you as well. So hopefully some theory, but definitely some good practical interactive sessions as well.
So Ruth, leading up to the roadshow, I understand there'll be some online learning modules available for nurses, some speed learning modules. Can you tell us more about that?
So, we know that healthcare professionals are really busy. So as part of our Closer to Zero online learning platform that we've developed, particularly over last year with COVID and, there's obviously less opportunities to face-to-face learning, we've now added to that our speed learning modules. And so what these do is provide very short, bite-sized, easy modules that cover some of the basics and fundamentals in wound care, just as good refreshers, around things like the skin, wound healing, abnormal healing, acute wounds, hard to heal wounds, and some of the basic principles, such as wound bed preparation around the time framework, which stands for tissue, infection, moisture, and the edge of wound. So really, hopefully, if you could work through these, there's about 12 modules, and they're about 5 to 15 minutes long only. So if you can work through those prior to coming to our workshops, that will really give you some good, basis so that you can really get a lot out of the workshops. So we'll be sending weekly reminders, I believe, so that hopefully you can fit them into your busy schedules over the next few weeks and months leading up to the roadshows to really supplement your learning. And while you're on that Closer to Zero platform as well, you may want to look at some of our other online learning there, webinars and podcasts that we have. Some of these are delivered by global experts and obviously a little bit more in depth, but you may want to have a look at those as well, particularly around things like venous leg ulcers, skin tears, infection management and so on. But as I say, the speed learning, they'd be a really good, I think, quick, easy learning segments that you can do before coming to the roadshow. Well, thank you for having me today and for the opportunity for us to be able to share about what's coming up in the roadshow, and we look forward to seeing the APNA delegates there.
So in order to access those free speed learning online modules for wound care and wound management brought to us by Smith & Nephew, do head to closertozero.com.au. And for more information on the 2021 APNA Conference Roadshow, there'll be a link in the show notes of this episode.
This podcast is brought to you by APNA, the Australian Primary Healthcare Nurses Association, and is only made possible by our members. Join today. Google APNA membership.
Who has the time to wade through every piece of healthcare news? Primary healthcare nurses certainly don't. Fear not. APNA's Weekly Connect e-newsletter condenses key industry news into digestible content while serving up a feast of useful resources. Stay in the know and save time. Subscribe for free at www.apna.asn.au.
Recently, Matt St Ledger caught up with APNA's Marg Dempsey and chronic disease management nurse Di Mears. Di has demonstrated amazing success in establishing a nurse-led clinic in her practice in Toowoomba, Queensland. A brilliant initiative which ensures coordinated care for patients with coronary heart disease within a regional community.
Today we're exploring the concept of nurse clinics, and I'm joined by APNA's Margaret Dempsey and registered nurse and APNA member Diane Mears, who has established a nurse clinic within her workplace. So firstly, Margaret, welcome. Can you tell us what you mean by nurse clinics?
Well, simply, nurse clinics are nurse-delivered, team-based models of care. And in the primary care setting, the nurse clinic models support a coordinated approach to care delivery with nurses at the forefront of that coordination. Of course, this also involves the patient's GP and other members of the team, which may include allied health providers or non-clinical team members at the practice. So successful nurse clinics rely on involvement from the whole practice team. It's not just the nurse, it's a team approach.
And what's the evidence behind nurse-led clinics?
The Australian Institute of Health and Welfare identifies that we have an ageing population, increased burden of chronic illness, along with increasing complexities of care. And this is set to worsen with the after effects of a global pandemic, where people may have delayed healthcare treatments. So a shortfall in the GP workforce also adds to this burden, especially in rural and remote areas. General practices and primary healthcare services may therefore benefit from exploring innovative and alternate ways to deliver healthcare, and nurse clinics are one of these ways.
Welcome to Diane. Please tell us a little bit about yourself.
I guess I've been a nurse forever. I finished school and decided that's what I wanted to be. And 45 years later, I'm still enjoying the role. So it was perhaps a great career choice for me. I'm extremely passionate about my work and the promotion of primary healthcare nursing as a rewarding career path.
And can you tell us a bit about the nurse clinic that's established at your practice, and is it a specific area of interest for you?
We're located 100 kilometres west of Brisbane in Toowoomba in Queensland. For establishing a nurse-led clinic, I collaborated with one of the directors and our practice manager, and the decision was made to focus on our patients with diagnosed coronary heart disease. The COVID pandemic certainly caused disruption to normal health services, and we recognised the need to ensure that best quality practice needed to be maintained. The risk factors contributing to heart disease continue, with a noticeable increase in obesity, smoking, alcohol consumption, anxiety, and physical inactivity during COVID-19. The aim was to try and prevent further cardiac events. We then expanded our cardiac focus to include the heart health checks to try and identify those who may be at risk of cardiovascular disease. And as well as being successful in receiving the APNA grant for our Improve Your Heart Health Clinic, we were also accepted into the Heart Foundation's Heart Health Check Recall pilot aimed at boosting preventative checks. Cardiac nursing, I guess, has been a particular interest of mine during my life. It made sense to set up a structured nurse clinic to ensure our delivery of optimal care to our patients and to identify risk.
So, Di, could you just walk us through what was required in setting up and the planning phase of establishing your nurse clinic?
Firstly, we needed to identify the patients in our practice who would be eligible for the clinic. Our initial panacea search was for those with cardiovascular disease, and this result was quite huge. So after further discussion with the director, we narrowed it down to those with diagnosed coronary heart disease or ischemic heart disease. And this reduced the numbers to 136 patients, which seemed much more manageable. It was important not to set ourselves up for failure, and it was these patients that we wanted to focus on. Improve Your Heart Health is run solely out of GPs on Curzon, and we were well set up for the clinic right from the beginning. All staff here meet regularly at a lunchtime clinical meeting, and the nurse-led clinic was explained in detail. with full support from all doctors, nurses and admin staff. I also engaged with a dietitian and exercise physiology group to gain their support for the clinic, and we had a site visit from the coordinator of the cardiac rehabilitation program that runs here in Toowoomba. The Improve Your Heart Health Clinic is primarily run by the lead nurse, but all nurses in the practice are aware of the requirements, such as recording the stats for APNA should I be on leave. There's a designated consulting room and a well-equipped treatment room available for the clinic at all times.
And Di, how is your clinic funded?
GPs on Curzon is a mixed billing practice. All patients with diagnosed coronary heart disease seen in the nurse-led clinic have GP management plans. So utilisation of the MBS items relating to chronic disease goes towards funding the clinic. The heart health checks, similarly, also a large part of the clinic, and the corresponding item number is utilised there to help fund these. All patients coming through the clinic are also seen by their doctor on the same day. Funds received through the APNA grant have been primarily used for costs involved in the setup of the clinic, promotion of the clinic using social media, website, blogs, Heart Foundation shirts and resources, and furthering nurse education and CPD. The grant has assisted with registration costs to enable my attendance at the APNA Roadshow later this year in November, and also with online courses, webinars relevant to the setting up of nurse-led clinics.
Marg, would you like to add anything further about funding models?
There's actually a lot of discussion about how nurse clinics can be funded to ensure viability, and often confusion comes from not understanding the nurse clinic model. So remember that nurse clinics support a team-based approach to care delivery. It's a coordinated approach with nurses leading the coordination and health professionals playing their part in patient care. So our current healthcare model relies heavily on revenue from Medicare items, which are GP focused or available to nurse practitioners. And this can work well for nurse clinics, but other funding might also be available through workforce incentive payments to the practice, grants from external organisations like APNA, primary health networks, perhaps local councils or local hospital networks may have grants available, or maybe even some private sector funding. And you may also consider the financial viability of patients who pay an out-of-pocket fee for service if that's an appropriate model. The good news is that APNA has done a lot of the groundwork and has developed an interactive nurse clinic budget tool, which allows you to model the financial impact of running a nurse clinic in your own setting. This is available on APNA's dedicated nurse clinic website, and I encourage you to take a look.
And Diane, how does your nurse clinic support and benefit your patients?
Our clinic recognises well-documented evidence-based lifestyle interventions that impact on heart health and provides a structured approach to continuously engaging with those patients to help reduce the risk and improve their understanding of their condition. We see these patients on a regular basis for care planning. Every 3 to 4 months, we revisit their own goals, their goal setting, and provide ongoing education on diet, physical activity, smoking cessation, regular screening, medication review to optimise blood pressure and lipids, and also diabetes control. We also encourage them to connect with appropriate allied health providers and provide these referrals as part of their plan and part of the team. Patients have been very happy to participate in the clinic, and they're very thankful for the care and attention that they receive from the whole team here. It's been very encouraging. Feedback has all been favourable. We received a new referral recently. We saw a lady for the first time and her sister had recommended that she come here. I saw her for her first care plan and she was simply amazed at the time that we took to listen, to coordinate her own health plan. It wasn't a one-size-fits-all. We listened and we gave her what we thought was best for her, and she agreed. And after many years in primary health care, it's this feedback that encourages us to keep doing it.
How does the clinic assist you on a personal level?
Well, it's a team here. You know, I'm not doing this on my own, and in fact, you couldn't do it on your own. Without the support of all of the doctors, the other nurses, and our fantastic admin staff, this wouldn't happen because there's a lot of behind the scenes work that goes on. So it really is the team that keeps everybody going and keeps this clinic running to capacity, really.
Di, how has the clinic assisted your practice and your community more broadly?
Running this clinic has just reinforced what a great team we have here. One person just can't do this on their own, and it's pleasing to see everybody on board with it. But it also causes us to look at continuously evaluating what we do. Is there something we can do better? Are we doing as much as we can for our patients? And are we seeing the desired outcomes? Patient feedback has all been favourable, and we will continue to utilise the patient evaluation satisfaction surveys to gauge whether something in our delivery needs to change or improve. Quality improvement's been an interest of mine that has grown rapidly over recent years, and I'm quite passionate about that, and data cleansing. Keeping records that are accurate, searchable, coded and current. One of the most important steps for any organisation if you want to create a culture around quality, data decision making and better overall operational efficiency.
Thank you, Diane. And thank you, Margaret, for joining the conversation. It was really interesting for nurse clinics to be showcased. Nurse clinics are well placed to meet the increasing demands on the primary healthcare sector, with positive benefits including a coordinated approach to care, leading to improved patient health outcomes. I do encourage you to visit APNA's Nurse Clinic website to learn more about how nurse clinics can benefit your practice. Head to nurseclinics.apna.asn.au and there'll be a link in the show notes of this episode.
Nursing Australia, the podcast for Australian nurses working together towards a healthier Australia.
If you are listening to Nursing Australia right now on Apple or Google Podcasts, please don't forget to tap the subscribe button, and on Spotify, click follow. On the next episode of Nursing Australia, we are getting ready to hit the road, so grab the latest on the upcoming 2021 APNA Conference Roadshow. Discover how nurse certifiers are optimising diabetes management, and a new program which promotes enhanced nursing practice when caring for people with autism. I'm Suzanne Blackeby, and thanks for joining us on Nursing Australia.
Nursing Australia, the podcast for Australian nurses working together towards a healthier Australia. For more information, please visit us at www.apna.asn.au. Thanks for listening to Nursing Australia.